I'm Professor Andrew Chilton. I function in the role of a consultant gastroenterologist. I'm also the chair of the cancer board for the integrated care system that we all work in, and I lead on cancer at Kettering General Hospital. The one thing I know without a shadow of doubt is how valuable collaboration is in making patients' journeys far smoother and far more meaningful and getting better outcomes. Now, in some areas we do this, and we do this very effectively, but in other areas less so. And it's really important that we all develop a hive-like mentality whereby we're providing effective joined-up care and collaborating for our patients' sake, because it's all about the patients and patient access and better outcomes. We share bowel cancer screening between Kettering and Northampton, and the screeners work very effectively with each other. A colleague of ours at one of the organizations identified what looked to be a complex low polyp in a patient's rectum and put this up on a virtual MDT where we all review the images, and the question was asked was, could this be removed endoscopically? The expertise to do this sat at Kettering, and we offered to go ahead and do that. An MDT is a multidisciplinary team meeting, and we have many of these, and they tend to congregate around different types of cancer sites. So there's an MDT for bowel cancers, there's an MDT for cancers of the prostate and bladder, and this brings together people of all sorts of expertise. So cancer doctors who provide chemotherapy and X-ray therapies. It brings together pathologists, X-ray doctors, and specialists in those areas such as surgeons and gastroenterologists, along with specialist nursing staff to give you a really holistic understanding of your care and to provide you with the best possible outcomes of that care. The polyp was removed at the time, and when it was sent off for analysis, the polyp had actually progressed to the point where it was a cancer. Fortunately for the patients, the polyp hadn't invaded any deeper, or the cancer hadn't invaded any deeper, and the patient was therefore completely cured by an endoscopic resection. What this meant for the patient was that in a space of 2 weeks they had gone through identification of a polyp, they'd gone through a series of imaging on the same day, and they'd had their endoscopic therapy carried out, which then demonstrated this to be a cancer. Now, if this had been biopsied, the patient would likely have progressed to an operation, and the operation would have resulted in a very invasive operation and likely a bag requiring a colostomy. So what we had was a patient who's, through close collaboration of two teams across the system at Northampton and Kettering, really changing an outcome for a patient and making their journey that much more simple and smooth with a fantastic outcome. Now, we need to find ways of collaborating effectively across all the different tumour sites, and we need to see the patients as belonging to all of us and our responsibility to make patients' journeys as smooth and as effective as possible with the best possible outcomes. And by collaborating together, we can pool our resources and we can achieve these better outcomes for patients. The collaboration we're undertaking is far more than just looking at a group model between Northampton and Kettering Hospital. The collaboration involves the entire locality or system, as it is sometimes called, and I see this as comprising of our patients, our public out there, our GP colleagues, and all healthcare, our CCGs, who commission the health from the various hospitals. So it's looking at how we can work far more effectively hand in glove with each other in order to achieve the best possible outcomes for our patients. I would like people to be thinking about how we work as a system rather than how we work within the individual hospitals or with our individual specialities, because it's quite easy to get lost in your individual speciality and not see the bigger picture, and we need to rise above that and recognize that at all times we need to be seeing how we provide the best possible outcomes for our health community and provide them with effective care.